Hey guys, today we're going to be talking about reproductive technologies. So we're going to be talking about what natural family planning is and how that works. We're also going to look at different ways of pregnancy prevention, including both hormonal and barrier methods. And we're also going to look at the opposite of that, the different ways of increasing reproductive potential. So helping people with fertility issues, for instance. And then we're also going to briefly look at some prenatal technologies. So first of all, you do need to know what stem cells are. So stem cells are just undifferentiated cells, meaning that they haven't yet differentiated into different types of cells like muscle cells and heart cells and liver cells and skin cells. These cells can be made to differentiate under the proper circumstances. So you can take a stem cell and put it under certain conditions and make it turn into a heart cell or a skin cell or whatever. Most of your body's cells are already differentiated. You don't have a lot of stem cells in your body, but they are super useful in treating a ton of different illnesses, everything from like cancer to genetic disorders to anemia to like severed or damaged spinal cords, right to like baldness. Lots of different things can be treated with stem cells. Stem cells are found in your bone marrow. They are also found in umbilical cord and in blastocysts. Stem cells from blastocysts are often called embryonic stem cells, and they are very controversial. If you take the stem cells from a blastocyst, that blastocyst can no longer develop into a fetus. It essentially can only be used for stem cells at that point. And so some people find that a little bit murdery. It depends on when you define the start of life happening. So if you think that life starts at the point of conception, then you're usually against the use of embryonic stem cells. If you think that life doesn't start until later into the pregnancy than that, then you might be okay with the use of embryonic stem cells. Umbilical cords, a much less controversial source of stem cells because they can be harvested from the umbilical cord after the baby is born and when it doesn't need those stem cells anymore. Okay, so with pregnancy prevention, there are a ton of different technologies that can be used as birth control, essentially. The most effective way to prevent contraception and STIs is, of course, abstinence, just don't have sex. And contraceptive use of any kind is not supported by the Catholic Church. So the Catholic Church is, for the most part, against the use of both hormonal and barrier forms of contraceptive. Instead, the Catholic Church supports something called natural family planning, which is the only way to control when you're having children or how many children you're having. Essentially what natural family planning is, it's when the couple just tracks the women's menstrual cycle and then refrains from having sex anytime kind of around ovulation. So about the week before ovulation and a few days after ovulation, they will abstain from sex because that is when the woman is most likely to conceive. If used properly, that method is about 85% reliable, but sometimes it can be difficult to track a woman's menstrual cycle because women have different length cycles. Hormones are a fairly common use of contraception, of pregnancy prevention. This includes the birth control pill, but also IUDs, which are intrauterine devices, contraceptive implants, injections, patches, vaginal rings, all that kind of stuff. Those are about 99% effective or more if used properly. By if used properly, it means like, for instance, if we're talking about the birth control pill, it has to be taken at the same time every single day. If you miss a dose or if you're late taking a dose, then you're not using it properly, it becomes less effective. Both of these methods of pregnancy prevention contain either estrogen or progesterone or both. And so what that does is those hormones will create a negative feedback loop, which prevents the release of GnRH from the hypothalamus. If the GnRH is not released, then the pituitary won't release LH or FSH. If LH isn't released, then there can be no ovulation. A spike in LH is what triggers ovulation. So as long as there's no luteinizing hormone, there will be no ovulation. Without ovulation, there is no egg to get fertilized. On the other hand, if FSH is the hormone that's not being released, without FSH, you won't have the development of the follicle and the egg. And then once again, there'll be no egg to be fertilized. Okay, so those are types of contraceptives that are used kind of regularly. If it's the birth control pill, it's a pill that's taken every day. If it's an IUD, then it's inserted and just stays in the uterus for years. Implants, which aren't at this time, I believe, not used in Canada, but they will also be put under the skin and stay there for years. So those are all kind of like pre-planned types of contraceptive. But there's also emergency contraceptives, which includes like the morning after pill, which is kind of the most common type of emergency contraceptive. That also uses hormones to prevent pregnancy. So it'll release a medication which blocks progesterone receptors so that any progesterone that the body has produced can't function. And so what that means is that if the progesterone isn't able to function properly, then it can't build up and maintain the endometrium. So the endometrium will be shed. So it essentially kind of triggers the start of your menstrual cycle. Usually you'll have like a little bit of bleeding that comes along with that, just because it is shedding any of the endometrium that was built up in your uterus at that time. These medications can also prevent ovulation so that no egg is released. So it prevents an egg from being released so that there's no egg there for fertilization to happen. If, however, you had ovulated prior to taking the morning after pill, then it would still make sure that even if fertilization happened, there's nowhere for that blastocyst to implant into because your endometrium has been shed. The pill form of these is considered 89% effective. There is also an IUD form of this, which is 99% effective. And then other than hormones, you can also use barriers as a way to prevent pregnancy. The most common type of this by far is male condoms, which I'm sure you guys have heard of before. They block sperm from entering the vagina, and they are 98% effective if used properly. And in this case, by used properly, they mean, for instance, that they're being properly lubricated, that there's enough space left between the tip of the penis and the end of the condom, that you're not using two condoms at once, which usually just causes them to break, that kind of thing. Female condoms do also exist. They're about 95% effective. They work kind of the same way, only they're placed inside of the vagina right away instead of on the penis. There's also something called diaphragms, which are placed in the vagina and block sperm. If used with spermicide and inserted at least 6 hours before sex, they are 95% effective, but that does, of course, take a lot of pre-planning. There's also something called cervical caps, which cover the cervical opening and stop sperm from getting from the vagina into the cervix. Those, again, also must be used with spermicide, which is just a chemical that kills sperm. But if used properly, they're 95% effective. There's also contraceptive sponges, which are little sponges that are filled with spermicide that will kill sperm. They must be placed in the vagina and then left there for 6 hours following sex to make sure that all the sperm is killed. If used effectively, they are 88% effective. And then there's also some surgical options. The most common of these is the vasectomy. So this is when the vas deferens are cut and tied in order to prevent the movement of sperm from the testes to the ejaculatory duct. It is a fairly minor procedure. Usually you don't even have to be knocked out to get a vasectomy. You don't have to stay in hospital. They just little tiny cut, and that's all it takes. A tubal ligation is kind of the female version of that. That's when the fallopian tubes are cut and tied to make sure that the sperm and egg can't come into contact with each other. The sperm can't get up the fallopian tube, the egg can't get down the fallopian tube. But that is a much more involved surgery. It does require hospitalization because to get to the fallopian tubes, you have to dig through the abdominal wall and that kind of stuff. So yeah, the recovery for that is much longer than for a vasectomy. This, once again, just like the barrier and hormonal methods of contraception, is not supported by the Catholic Church. Okay, so those were all the ways to decrease fertility. But there's a bunch of ways to increase fertility as well. So usually these are used by couples who are having trouble getting pregnant and who want children. Issues with fertility can be caused by either male or female reproductive issues. Both are equally likely. A couple is considered infertile if they have been trying to have a child for a year or more with no success. So the easiest way to increase fertility is by the use of fertility drugs. These fertility drugs contain follicle stimulating hormone, which essentially supercharges your ovulation. So it causes more eggs to develop inside the follicle at once, and it also causes more eggs to be released and ovulated at once. So if the issue with fertility is that the female isn't ovulating regularly, then this method can be really useful. There's also a method called artificial insemination. This method is more useful when the fertility issue is not on the woman's side, but instead with the man's sperm. So if his sperm has low motility, so the sperm don't swim well, or if he has a low sperm count, then that just means that it's more difficult for his sperm to reach and fertilize the egg. So instead, what will happen in the case of artificial insemination is that the sperm sample is taken from the man, it's concentrated, and then it's kind of injected directly into the uterus right after the woman ovulates. And so by kind of bypassing the vagina and the cervix, it makes it much easier for that sperm to reach the egg. Again, the vagina is a harsh environment. There's mucus that can trap the sperm. There's acid that can kill the sperm. The cervix has all of those dead end like mazes that the sperm can get lost and die in. So by bypassing all of that and going right to the uterus, it makes it a lot more likely that the sperm will survive and reach the egg in the fallopian tube. Again, it is not supported by the Catholic Church. I think most of these, maybe all of these, are not supported by the Catholic Church. There's also a method called IVF, which stands for in vitro fertilization. So we start this process by preparing the ovaries for ovulation. Usually that can be done with some follicle stimulating hormone, some of those fertility drugs. Then a small laparoscopic device is inserted, and it has a little suction cup at one end, and you essentially extract the eggs out of the ovary once they're developed. You then take those eggs and put them in a petri dish. You take some of the male sperm, add that to the petri dish, and then you wait for the eggs to be fertilized by the sperm. Once the eggs are fertilized, you incubate them for a couple days until you have like a bundle of cells now, and then that is transferred into the woman's uterus. The benefit of that is that it makes sure that fertilization actually happens, and then once fertilization is achieved, it's ready to be implanted. Again, not supported by the Catholic Church. And then there's also a method called GIFT, which stands for gamete intrafallopian transfer, which is when you collect the eggs the exact same way as you would for IVF, and then you just insert the sperm and the egg into the fallopian tube, so fertilization can happen there. So this is for people who don't like the idea of a baby being conceived in a petri dish. They want it to still happen inside of their body. There's also a method called cytoplasmic transfer. This is usually used in older women who have a high risk of having a baby with genetic defects or birth defects. And so what they do in this case is they take the cytoplasm from a younger woman's egg and transfer that cytoplasm into the egg of the older woman. By only transferring the cytoplasm, the child will still be 100% genetically the older woman and her husband's, because the DNA is not included in the cytoplasm. But it is thought that that younger cytoplasm will reduce the likelihood of some of those defects in the child. Surrogacy is also an option for couples who are struggling with pregnancy. This is when in vitro fertilization, IVF, is used to create the embryo, the exact same as we just talked about with the IVF, only this time the embryo isn't implanted into the mother, it's implanted into a surrogate, which is a different woman. And that other woman will carry and deliver the child for the couple whose egg and sperm it is. So in this case, the birth mother and the genetic mother will be two completely different women. But this is really useful, especially for women who pregnancy would be really risky for them for whatever reason. Okay, so that's kind of all the different ways to increase a couple's fertility or help a couple with fertility issue. The last thing we're going to be looking at now is some prenatal technologies, which are different technologies that we use to gain information about a fetus. Usually these are used to detect different untreatable fetal disorders. So the first is just ultrasounds, which most women get nowadays. What that involves is the bouncing of high frequency sound waves off of the fetus. The sound waves bounce back and create an image of the fetus. And that is not at all harmful to that fetus. Then there's amniocentesis, which is when a hypodermic needle is put through the mother's stomach into the amniotic sac, and it's used to draw out a sample of the amniotic fluid. That fluid will contain some fetal cells, and then a DNA analysis will be done on those cells. That usually happens around week 15 to 20 if it's going to be done. And then there's also something called chorionic villi sampling, which is CVS. That is when a sample of the actual chorion is removed, and then some of the DNA from that is analyzed. That can be done earlier in the pregnancy than amniocentesis, about week 10 to 13. During the DNA analysis, whether it's from the amniocentesis or the CVS, a complete set of that fetus's chromosomes is obtained, and then that set of chromosomes, which is called the karyotype, can be analyzed for any genetic disorders. So like I said, ultrasounds are a regular part of most pregnancies. They're not at all harmful, so they can be used kind of whenever. Amniocentesis and CVS are only done if a prenatal screening test came back as worrying. So for instance, if something potentially worrying was showing up on the ultrasound. Or it might be used if the mother is over 35, because, like we talked about, that increases the risk of these different disorders. Or if the mother had a previous pregnancy where there was a neural tube defect, so where the central nervous system didn't form properly. Or if there is a genetic condition that runs in the family, or you know that one of the parents is a carrier for a specific genetic condition. The reason that amniocentesis and CVS are only done under those circumstances is that they do come with a slight risk of miscarriage. Very slight risk, only 0.6 to 0.7%, but again, that's more than you would want to risk for no reason. Amniocentesis is also done in order to check fetal lung development if the mother has to give birth early because of her own health complications. So you would want to make sure that the baby's lungs are developed enough for the baby to survive before you initiated labor. Okay, and that is it. Let me know if you have any questions.